Colorectal cancer is the second leading cause of cancer deaths in the United States. About 140,000 Americans are diagnosed with colon cancer every year. About 50,000 people will die from it. Health professionals say regular screenings are key to prevention. A new study involving Oklahoma veterans seeks to determine what kind of test is most effective at curbing colorectal cancer mortality rates.
March is National Colorectal Cancer Awareness Month, and the message being delivered in a series of celebrity public service announcements is clear. Early screening saves lives.
The screenings that happen here might be fun or dramatic, but it's not real life. There's another screening that is real life, and it could save your life. It's a screening test for colorectal cancer.
Colon cancer begins with an uncontrolled multiplication of cells lining the colon. Before true cancer develops, it usually begins as a non-cancerous growth called a polyp. Polyps have the potential over the course of several years to become cancerous tumors, growing rapidly in size and eventually spreading through the lymphatic system to other parts of the body. Symptoms of colon cancer include blood in the stool, a change in bowel habits, abdominal pain, and unintended weight loss. Dr. Mark Mello is a gastroenterologist at Integris Medical Center in Oklahoma City. Mello says the risk of developing colorectal cancer increases with age, and genetics is a major risk factor.
If you have a single first-degree relative like mom or dad or brother or sister with colon cancer, your risk is significantly increased over the average person, and your risk increases more depending upon the number of family members who've had colon cancer.
Diet also appears to play a role.
Diets that are high in red meat and saturated fats and low in grain fiber are the things that might increase your risk of colon cancer.
Because precancerous polyps don't always cause symptoms, it is important to undergo regular screenings.
In the average risk person, and that would be somebody who has no symptoms and no family history of colon cancer, your first colonoscopy should be at age 50. The colonoscopy is performed by using a flexible tube that has a camera on the end of it. It is inserted into the rectum and advanced through the colon. The polyps can almost always be removed directly at the time of the colonoscopy. If we're talking about colon cancer, the success rate for overall treatment long-term is very much dependent upon the stage that the cancer is detected.
Colonoscopies do have drawbacks. The procedure is invasive, and most patients don't like the prep work, which involves taking laxatives to remove anything left in the colon.
They still don't taste good. I can attest to that myself. We are frequently using what's called a split prep, where you take half of the dose in the evening and half of the dose the next morning before your colonoscopy, so you're not drinking as large a volume at a given time.
The colonoscopy is considered to be the gold standard of tests for colon cancer, but it's not the only one.
Perhaps the most interesting competitor to colonoscopy would be a specialized CAT scan, CT colonography, where a CT image is actually reconfigured into a motion picture, and so it looks almost as if you're doing a colonoscopy without the scope.
Another less invasive screening procedure is the subject of a study by Veterans Administration hospitals across the country. The Oklahoma City VA Medical Center is one of 42 VA facilities nationwide chosen to participate in the research, which will compare colonoscopies to a procedure known as a fecal immunochemical test, or FIT. The test involves checking the stool for blood as a cancer risk marker. Dr. Mohammed Madhoun is an assistant professor of medicine at the Oklahoma City VA Hospital.
Fecal immunochemical testing is actually less invasive and it's not expensive. And we do have a good evidence to support that it does reduces the mortality from colorectal cancer.
While a colonoscopy is done once every 10 years, FIT must be repeated annually. The Oklahoma City research team will spend the next 2.5 years recruiting 1,250 veterans for the study to compare the methods.
The follow-up phase is going to last for 10 years, and we're going to follow up those patients and see what happened to them, and then compare the two arms together with regard to the reductions of the mortality of colorectal cancer.
Any veteran between the age of 50 and 75 with no symptoms and no family history of colorectal cancer can participate in the research.